The patient, 63-year-old Conrad Everett, was hospitalized here at the private Belize Healthcare Partners on March 27th.
So the patient was initially admitted on the 27th of March at Belize Healthcare Partners Limited. He had an initial diagnosis of community-acquired pneumonia, and he was there till March 30th, which is when we understand he self-discharged himself from the institution, returned on March 31st with respiratory distress. He was intubated on March 31st at Healthcare Partners Limited. When he was referred to Carl Huchner on the 7th, he had already been 7 days connected to a ventilator. So he arrived to Carl Huchner on the 7th, which is Tuesday, and was sent to ICU care from that same day when he arrived. The patient continued to deteriorate, progressive deterioration. He was swabbed at Carl Huchner on Thursday, April 9th. We had a preliminary screening test at around 3 p.m. and so Carl Huchner staff was alerted at that time of what the potential result would have been until we got the confirmatory test.
This particular case is accompanied by some nightmarish circumstances as to the exposure of many persons to the patient before he died. In the result, the overall picture clearly demonstrates the possibility of widespread transmission of the virus.
The first question is, how widespread was transmission at the KHMH?
ICU staff at Carl Huchner did consider this patient to be a potential suspect, as we do with any patient who has had a previous negative sample. So that patient the staff there did use the proper PPEs in that regard.
But that opinion has been condemned as contradictory and misleading by the Hospital Workers Union. They say that, quote, many staff who came in first contact with patient 10 used a mere surgical face mask and gloves at A&E. The same were used at the ICU with a linen gown. Limited N95 masks and surgical gowns were provided to the ICU staff upon the patient's admission. These PPEs are claimed to be held under lock and key due to the fear of wastage by the staff. But whether or not the PPEs were adequate, the KHMH isn't taking any chances, and the hospital has taken the decision to swab and quarantine all staff members who came into direct contact with the patient when he was in an acute state. But before all that, Ministry of Health contact tracing has led them to downtown Belize City, an area of concern where a cluster of infections could have been spawned. It started here at the downtown plaza, where on Saturday, March 14th, there was a party. An unknown number of persons attended, including some with a recent travel history from the US. And then across the street to Brody's, where an immediate relative of patient 10 worked. She has also tested positive. It goes on to Scotiabank Albert Street, where yet another immediate relative worked. All three businesses were shut today. Now, the Ministry of Health is asking that those who were in attendance at that March 14th party call their hotline for instructions on self-isolation and whether or not they should be swabbed. And today, the Director of Health Services had this to say about the party's guest list.
We are tying this particular last cluster to a social activity that involved preliminary data suggests up to 100 people. I don't think we have a full guest list, or we didn't have it. That's the reason why we made a call yesterday. That's where the potential ground zero may have been for that particular cluster. So when you trace back the previous 14 days, then you go to an activity on the 14th of March that had people who had come in from the US, New York, we are now told, and that's where the potential outbreak may have happened.
An outbreak whose dimensions may take weeks to be fully known. Charisse Halsall, 7 News.